A very good morning to one and all. Today we are going to discuss another topic, that is tympanic membrane perforation. First we will discuss about the definition. A perforated eardrum or punctured eardrum is a rupture or perforation of the eardrum which can all occur as a result of otitis media, trauma, explosion, noise or surgery. So tympanic membrane perforation means it is a rupture or perforation of the eardrum, that is called tympanic membrane perforation, a punctured eardrum, that we can call it as tympanic membrane perforation. So here what is happening means there is a rupture or hole is occurring on the eardrum which can occur due to the result of otitis media, that is ear infection, then trauma. While trying to clean the ear with sharp instruments, there's a chance of trauma to the eardrum. Yesterday we have discussed about this particular things, wax removal. So while removing the wax with the help of some instruments or some inorganic material, that can lead to trauma to the eardrum. Then explosion, sound explosion, if high sound explode is occurring, then noise or due to some surgery, accidental creation of a rupture can occur. If any surgery is going in the external ear, sometimes accidentally it can lead to rupture of the tympanic membrane. So that particular condition is called tympanic membrane perforation. Let us see the causes. Infection of the middle ear, we have seen, that is otitis media, which can damage the eardrum. Then direct injury to the ear, either punch to the ear. So if somebody is blown to the ear, or if some direct injury is occurring due to inserting some kind of instruments or some kind of articles, can lead to direct injury. A sudden loud noise, that is called explosion. Suddenly we are, especially in the festival time or in during functions and or we can see that the people are playing the DJ. So a high loud noise is coming from the DJ. So that much sound we can't able to tolerate with our ear. So sometimes eardrum can break. Then barotrauma, when the altitude is changing. Okay, when barotrauma means air pressure is changing. So when the height, when you are going too much height, or that time the altitude is changing, and that can lead to changes in the ear pressure, will lead to injury to the tympanic membrane. Then during cleaning the ear and rupture during surgery. So these are the possible causes can lead to tympanic membrane perforation. Let us see the types of eardrum perforation or tympanic membrane perforation. Perforation at margin of the eardrum, that is the first type. This is a perforation that occurs at the margin of the eardrum, where the eardrum and the ear canal come together. So when you are seeing the structure of the eardrum, you can see it from the anatomy and anatomy textbook. There you can see in that marginal side of the eardrum, you can see in that where the eardrum and the ear canal is coming together. So that area is getting ruptured, that we can see in margin of the eardrum. Then second one is central eardrum perforation. A perforation can occur in any location on the eardrum. The size of the perforation varies from a small opening to a total eardrum perforation. So central eardrum perforation or injury means there is a perforation can occur in any location of the eardrum. Anywhere in the eardrum, that particular hole can occur, and it varies from a small opening to a large opening. Okay, it may be entire eardrum can open, or sometimes a small portion can open. Then attic perforation of the eardrum. Attic means it is a attic. The word means uppermost. This is a perforation in the superior part of the eardrum. This is referred as an attic perforation. So if any kind of perforation or hole is forming on the upper part of the eardrum, that we can call it as attic perforation. So these are the types of perforation. Perforation at the margin of eardrum, central eardrum perforation, and attic perforation of the eardrum. Let us see the pathophysiology. So due to the etiological factors, we have seen so many of etiological factors, either it is an infection or trauma. What is happening? Increased pressure in the middle ear. Inside the middle ear, pressure will increase. That can lead to pressure buildup and pushes against the eardrum. There's a chance of pressure buildup inside the middle ear, and it can lead to pushing against the eardrum. When the pressure further increases, eardrum perforate and may to lead to injury, extend to the ossicles and to the inner ear. So this is happening in the ear tympanic membrane perforation due to the infection or trauma. There is a pressure is occurring on the middle ear. It will push against, or the pressure will build up and push against the, or it will increase and it will push against the eardrum. When the pressure is further increasing, that can lead to perforation of the eardrum. Okay, so this is happening in the tympanic membrane perforation. Let us see the signs and symptoms. Pain will be there, earache or otalgia, discomfort. People will be more irritated. We can imagine if some of the ear problem is there, means it is very irritated. Okay, people is more in distress. Then hearing change or loss. Sometimes hearing change can occur, means that ability, either unilateral, bilateral hearing loss can occur, or sound reduction will be there. Then fullness of ear, you can feel something is filled in the ear, some heaviness or air fullness, like that you can hear. Then ringing sensation or a tinnitus. Then blood discharge from ear. So if it is some injury or some breakage is occurring in the eardrum, then you can see that along with the ear discharge, blood stain will be there. Pus discharge when the cause is otitis media. If otitis media is there, then pus discharge will be there. And vertigo. Okay, vertigo, it's a transient sensation of consciousness. So that vertigo will be there. And vertigo is associated with nausea, and vomiting will be there, and some kind of fainting will be there. Then next is the diagnostic evaluations or diagnostic procedures for tympanic membrane perforation. It including history collection, collect a proper history about the person, past, present, and any family history, that also we have to collect. Any recent exposure to sound, or any recent cleaning of ear, or whether they are having any ear infection, whether they're treated for some ear infection. This all kind of history you have to collect. Physical examination you have to do properly. External ear you have to examine properly, any discharge, any presence of swelling, redness, blood stained discharge. Then otoscopic examination help to evaluate the inner part of the ear. Then tympanometry, it will helps to identify the pressure inside the ear. And audiometry. Audiometry is a test we are using for evaluating the hearing capacity. So we can identify about the hearing capacity of the person with the help of audiometry. So these are the diagnostic procedure. Let us see the management. First of all, we can see what are the medical management. In that, there are pharmacological and non-pharmacological management is there. No treatment is needed in mild cases. If it is a mild case, then there will not be any treatment needed. Tympanic membrane with small torn and holes will heal by itself in most cases. Why we don't need any treatment for mild case? This is because tympanic membrane with small torn and holes will heal by itself in most cases. So it's having a capacity to heal by itself. The problem will be solved inside. A torn eardrum will usually heal by itself within 6 to 8 weeks. So within 6 to 8 weeks, it can heal inside. Okay. Then advise the patient to keep the ear dry and clean. Avoid water getting into the ear. Apply cotton with while showering or washing hair. Avoid swimming until it healed. So if it is a mild tone or if it is small tone, then automatically it will heal. So some of the things we have to remind is, we have to advise the patient to keep the ear dry and clean. Always tell them to keep the ear dry and clean. Otherwise, infection can increase. Then avoid water getting into the ear. If water is going inside, then the perforation will, or that particular condition will lead to some other infections. Then avoid swimming until it healed. Then we can see some pharmacological management, include administration of antibiotics. If there is any risk of infection, then we have to administer antibiotics. Then analgesics. If person is having otalgia or earache, we can administer analgesics. You have to write the examples. If perforated eardrum is due to foreign body in the ear, do not try to remove it itself. So if sometimes the perforation can occur due to foreign body insertion or foreign body in the ear, it may be wax or it may be some other flies or organic or inorganic things. So don't try to remove it by self. Okay, means without any monitoring or without any visualization or observation, you should not try to remove it because it can lead to more injury. Let us see the surgical management. Surgical management indication is unhealed tone and large tone. So we in the beginning we have discussed that in non-pharmacological man we have discussed that if it is a mild tone, then there is no need of any treatment. It will heal itself by 6 to 8 weeks. If it is a large or unhealed tone, if it is not healed or if it is a large tone or a large hole, tone means hole, then we have to go for surgical management, and that first one is tympanoplasty. So it is a surgical correction of the perforated eardrum. Plasty means repair. So here tympanoplasty, it will help to correct the perforated eardrum. Then myringoplasty, closure of perforation is called as myringoplasty. So closing the perforation or hole, that is called myringoplasty. Then ossiculoplasty, ossicular reconstruction is called ossiculoplasty. So ossicle means that word is related with bone. So bony reconstruction is doing if it is this particular surgery we are doing in case of severe tympanic membrane perforation. If the eardrum and the ear ossicle is affected, then we are going for ossiculoplasty. So these are the surgical management for tympanic membrane perforation. So let us see in detail. Tympanoplasty, it is a microsurgical procedure, uses patients' own tissues to reconstruct the tympanic membrane. So in this tympanoplasty, that is a repair or correction of surgical correction of the eardrum. In this surgery, we are using the person own tissue to reconstruct the tympanic membrane. Graft may be taken from different areas, include temporalis fascia. Temporalis fascia is a region you can identify from the anatomy test tube. Just side of the ear, that region is called temporalis fascia, or in the temporal lobe of the head. Okay, just lower part of the temporal lobe. So just identify from the anatomy book. Then alloderm graft, that is a synthetic material, may be used if patient have multiple previous surgeries. If already the person undergo surgery for eardrum, then we have to go for alloderm graft. It is a synthetic material. Or homografts and xenograft have less successful rate. So if you are taking from a donor or from other source or from animals, it is not successful. So this is about tympanoplasty. Then approaches we are doing post oral, end oral, and trans canal. So these are the approaches or through where we are doing the surgery. Transcanal approach means from directly through the eardrum. Then graft tissue is taken from this. This is a temporalis fascia. That's you can see in that area. Graft. Then we are graft is placing over the defect area. So that this is a eardrum photo. The defect area we are keeping the graft. Then classification of tympanoplasty type 1, it involves repair of the tympanic membrane alone. Yeah, that is called meningeoplasty. Only tympanic membrane repair is there. Type 2, it involves repair of the tympanic membrane and middle ear in spite of slight defect in the ossicles. So we can call it as ossiculoplasty. So in type 2, we are repairing the tympanic membrane and also the ossicles which is present in the middle ear. Type 3, it involves removal of ossicles when a large defect of malus and ingus in this tympanic membrane is repaired and directly connected into the stapes. So we can see that three bones are present in the inner middle ear, that is ingus, stapes, and malus. So here in type 3, it involving removal of ossicles. The infected or the defected ossicle is removing, and then it is connected with directly with the stapes. So the vibration or the sound impulses will transmit. Then type 4, repair when the stapes foot plate is movable but ligament is missing. Then type 5, repair of fixed stapes foot plate. So these are the classification of tympanoplasty, or these are the things we are doing or repair we are doing while in the surgery of tympanoplasty. Let us see what are the complications of tympanoplasty. It including bleeding or infection, pain, facial nerve palsy, rarely permanent, tinnitus, loss of taste, last few weeks, dizziness for a short time, partial or total loss of hearing may rarely occur. So these are the possible complications of surgery. Bleeding can occur. Sometimes it can lead to infection. Pain will be there, otalgia. Facial nerve palsy, because there are so many nerves are surrounded with the inner ear. Then tinnitus can occur, loss of taste, last few weeks, if any, especially glossopharyngeal nerve is getting compressed or getting uh, injured, that time this loss of taste can occur. Then dizziness for a short time because of the changes in the ear balance. Then partial or total hearing loss after the surgery. Also sometimes, as a complication of surgery, partial or temporary total hearing loss can occur. Let us see what are the management or health education. Avoid strenuous activity after the surgery. You should avoid strenuous activity. Walking is a normal activity that can be started straight away. You can walk, but you have to avoid strenuous activity. Keep the ear dry. Cover ear while taking a bath or shower. Use cotton ball coated with Vaseline to protect the ear. Do not lift anything heavier than 20 kg during the first postoperative week. Sneeze with your mouth open. While sneezing, you have to open your mouth. Otherwise, again, the pressure will create inside the eardrum and it will break. Blow your nose gently or avoid blowing nose. If you want to blow your nose, if some blockage or if something is happening, if you want to blow, then you have to blow gently. Otherwise, avoid blowing, because that also can lead to create air inside the ear, and it will push the eardrum. Avoid air travel during the first 2 weeks, because there's a chance of changing the altitude or the height. So air travel means or traveling in flight or aeroplane, that should be avoided. Then prevention. Some causes of ruptured eardrum cannot be prevented or avoided. A little caution can lower the risk. Okay? Sometimes you can't prevent the rupture of eardrum, especially in surgical risk and all, during the surgery time or during cleaning the eardrum. Treat ear infection early. You have to treat ear infection. If you found some ear infection is there, then you have to treat it early. Otherwise, vegetation can be occurring on the eardrum, or a bacterial growth can occur on the eardrum and can lead to perforation. Avoid flying or scuba diving if you have sinus infection or upper respiratory tract infection. If you are experiencing upper respiratory tract infection or sinus infection, you have to avoid the entertainment sports like flying or scuba diving. Then during fly or scuba dive, pinch nose and swallow air frequently to help equalize the pressure. Or if you are doing, or if the person is a athlete, then you have to advise them to close the or pinch the nose and swallow air frequently. Then never put anything in your ear even to clean it. Okay, especially while cleaning. If you want to clean, then don't put anything inorganic matter or any instrument. Never wear proper ear protection such as earplugs or protection designed for sports activities. So that is also important thing when you are exposing to some sound, or especially when you are dancing in front of DJ and all. It is very important to keep earplug or some protective devices on the ear. You can see in that people, those who are working in musical area and all, they are always keeping a headphone. It is not only to hear the sound, it is to protect the ear from sound explosion. So if you are keeping earplug, that will be helps to avoid such kind of injury or sound explosion. So this all about the topic tympanic membrane perforation. Is a small topic. We discussed about the definition, the causes. We have seen types of tympanic membrane perforation. Three types are there. Pathophysiology. Then we have seen the signs and symptoms, diagnostic evaluation, and the management. And we have seen detail about surgical management, tympanoplasty, in what all conditions we are doing, and what are the classification of tympanoplasty, and also post-operative care. And we have seen what are the preventive measures for avoid tympanic membrane perforation. This all about the topic. I hope all of you understood about the topic. If you are having any doubt, you can ask me. Thank you. Have a nice day.